next patient is the case of a 21-year-old professional motorcycle racer who presented to the medical center with a complaint of pain of the right hand. The patient had a bad fall while doing a motorcycle jump, falling on his right hand. His past medical history is unremarkable. He takes no medications. He works out and he has been racing since the age of 12. An X-ray showed boxer's fracture. Boxer's fracture is a common injury of the hand involving the fifth metacarpal bone. It's called boxer's fracture because of common occurrence in prize fighters and boxers. In this patient, however, it happened after a bad fall. The fracture fragment is sometimes angulated and may be externally rotated. That means it may be turned towards outside. This typically happens after direct trauma to the hand. It is usually caused by punching something harder than the hand, such as human skull or a wall. Typically the fracture is at the narrowest area near the distal end of metacarpal bone. Treatment is casting the fracture hand and conservative therapy. The next patient is a 30-year-old professional football player who's been complaining of ankle pain for the past 2 months. His pain is mostly in the posterior or the back of the ankle. Pain and discomfort is worse when he extends or flexes the ankle. Pain interferes with his game, especially when he runs. The patient states his problem developed after switching to a new different type of sneakers. This was mandated by the club that he was recently traded to. His past medical history is unremarkable, and he takes Orthopedic as an anti-inflammatory to help him with his pain. On exam, his Achilles tendon is very tender. Even the slightest touch or palpation makes him uncomfortable. The diagnosis of Achilles tendonitis was confirmed by physical exam and use of an ultrasound. Achilles tendonitis refers to the irritation and inflammation of the Achilles tendon, which is located in the back of the ankle. Pain and swelling are typical symptoms, but over the long run, the tendon can weaken, and rupture of the tendon is a serious matter, since it may cause chronic pain and disability. Typically, patients experience most of the pain during running and jumping. Changes in footwear and training schedules, as reported by this patient, could be a contributory factor to development of Achilles tendonitis. Treatment is RICE, which stands for rest, ice massage, compression, and elevation. Avoid injection of corticosteroids, which may be harmful in the case of Achilles tendonitis.